Hi, it's Kathy, and I've recorded this before but thought I'd do it again as the holiday season is upon us, and many of us are looking forward to connecting with family and friends. Other people may remember a season that once was and is no more. So I want to talk to you about an experience I had. My mother had Alzheimer's disease. She got it early in her early 60s and had it for 10 years before she passed. So we had 10 seasons, and we learned some valuable lessons as we experienced each holiday season. And here are the ones I'd like to share with you right now. They're written below here on this, underneath the picture. So these tips worked. I used them with my own family. I used them in my practice. First one is step into their world. Know that you will not win an argument when someone has memory loss. Keep sentences simple. Talk slowly. Discuss one topic at a time. And when asking your loved one to engage, do it with one activity at a time. Keep it simple. Avoid open-ended questions such as who, why, what, and stay focused on one topic, right? My mother asked the same questions over and over and over again, which became annoying to anybody not used to it. So simply answer the question calmly with a one-word answer. And if the question or statement isn't factual, just accept it as fact. Again, you will not win an argument. It'll only escalate, so avoid it and go along. This is one place you go along to get along. The second one is to engage all 5 senses. Remember, familiar ways through the holidays are actually captured in senses. Smells, such as cookies baking, sounds such as holiday music, sights such as old movies, tastes such as favorite food, or touch, such as the feel of a warm blanket. Involve your loved one in holiday preparations. As abilities allow, have your loved one help decorate, prepare food, or set a table. My mother was a great cook. She loved to cook, and she loved to decorate. But as her disease progressed, we thought, how could we keep her engaged in these activities? So one way we did it was after the potatoes were cooked and ready to serve, we gave her a spoon and she stirred them. Added a little butter and she stirred them. When flowers arrived, we gave them to her to place in a vase, one at a time. We played classic holiday music that had well-worn memories, and she sang along. Simple things to do, and it's things we're all doing anyway, so you can include people. Number 3, avoid catastrophic reactions. Anyone who's lived with someone with memory loss knows exactly what I'm talking about. This can happen. Children are so excited during the holidays, and they participate in many of the holiday gatherings, and their excitement is uplifting for most family members. However, the shouting, the running can be disorienting and overstimulating for someone living with memory loss or dementia. Large numbers of guests can be overwhelming, so ask your family and friends to spread out their visits if possible. If things get really hectic, designate a room or a space in the home as a quiet area where you can move your loved one to relax away from this activity and noise. During my mother's Alzheimer's journey, her grandchildren were all under the age of 10. So we would often move her into another room with familiar Christmas music playing so she could listen or just dance. She loved to dance too, to reduce her anxiety. We let her be the person that she always was and still is. This trick worked on every single holiday. Number 4, let people know ahead of time what to expect and how to respond, especially maybe they haven't seen the person in a while. Ask them to be patient, not to interrupt, not to correct, and give the person enough time to finish what they're saying. Even if they're stuttering or grasping for words, just allow them to complete what they think they said, even if it makes no sense. Let your visitors understand that these changes in behavior and memory are caused by the disease, not the person. Let people know too, there's a big one, that your loved one may not remember them or their name, or may look and act very differently than they knew. Prepare them for the changes in personality and behavior. So my mother didn't have the language as her disease progressed to interact with people she saw infrequently or were more recent in her life, including grandchildren. This was especially confusing for younger people as they could not understand, and so we would explain to the grandchildren who were old enough to grasp it and help them realize that it is not their fault. Children internalize a lot, that their Nana doesn't know them. Number 5, about those gifts. We don't need a lot of gifts here. So encourage family and friends to give something useful and practical. Photo gifts that stimulate memories or entertain them are thoughtful options. Choose gifts that express creativity. It's not demeaning. Adult coloring books are great, as is other crafting materials. You know, for my mother, we had a copy of my sister's wedding video that was perfect. She would sit and watch it for hours. Why? Because many of the people from her past were in it, even if they had passed themselves. They were front and center, and she recognized the voices and faces, even if she couldn't name them. She would even talk to them and have conversations with the video. Worked perfectly. Number 6, the meals, eating. This can be disruptive, so think about how dementia affects a person's appetite. You know, your loved one may not want a big dinner, or they may keep eating because they forget they already ate. Give your loved one a smaller portion and offer second helpings if hungry later. Avoid alcohol. We used to put a Diet Coke into a martini glass and give it to my mother. She didn't know the difference. She just remembered the ritual and the routine. You know, my mother loved to eat and would normally fill her plate with food. But to minimize problems, we would prepare a plate, cut the food into small pieces to make it appear to be more. In this way, everything appeared to be the same with her, with a few family modifications. So here are some tips for the holidays when a loved one has dementia. They helped us, and I certainly hope that they can help you.